Thank you to everyone. I know this came together in very short order, so that everybody is aware this is being recorded. As I think most people know, my name is Andrew Pariser. I have the pleasure of being the Vice President of RESCON. We somehow informally started and created a COVID webinar series, and so I guess this is the latest installment in that. This webinar is sponsored by the residential and infrastructure construction industries in partnership with our main union partner, which is LiUNA Local 183. And so very specifically, that is RESCON, ORCA, the RCCAO, the Ontario Sewer and Water Main Contractors Association, as well as the Heavy Construction Association of Toronto. We are delighted to have so many participants, and as I said, we're recording the event. We are also honored to be joined by the Minister, by the Chief Prevention Officer, Mike Gerard, and we'll be featuring a panel of health and safety experts. And you came to hear from them, so I'm going to try and keep my remarks short. So this is the latest webinar in our series, and it probably won't be the last. While we all wish that we could just flick a switch and get rid of COVID, we're starting to understand that we need to remain vigilant every day, and I think we learned that very quickly starting in March. But while we remain vigilant every day, we also have to plan for the future. And I guess what that means is planning, a day, a week, or a couple weeks ahead, because the pandemic has also kind of taught us that you can't look too far ahead. And that fact alone, I think, is causing strain across the construction industry, including on sites, in our offices, and in our homes. And I think, as Richard raised at the start, today is Bell Let's Talk Day, and that focuses on mental health. And we know that COVID impacts a lot more than our physical health. It impacts our mental health. We do have to give a shout out to the Minister of Mental Health, Minister Tobolo, because he has been a relentless champion when it comes to mental health, and the expanded resources and priority that this government has given mental health, speaks for itself. But as we look forward, this is about keeping our workers safe. This is about keeping our families safe. This is about keeping Ontario safe. And so on Bell Let's Talk Day, let's recognize that mental health is a health and safety issue, but it's also a health issue in general. At our last webinar, we focused on that we know what we needed to do and we just needed to execute. Looking at where residential and the infrastructure construction sectors have gone, I think we continue to have a track record of success and we continue to be safety leaders, but we're also have become safety leaders when it comes to developing new best practices and methods for keeping workers safe. While the pandemic has caused strain, it's also pulled the health and safety community together. And I think, I'm lucky enough to be a part of that community, and the health and safety community has certainly taken on the leadership role and kind of carried the entire construction industry on their back. And it's great to have two of the top leaders here with Minister McNaughton, as well as Ron Koletsky. And so with that, we're hoping, you'll get some valuable information here. You can take it back to your workplaces, to your family. I think there is light at the end of the tunnel, but we have to keep fighting complacency. We have to fight COVID fatigue. And I'm going to turn it over to Richard Lyle now, our president, to introduce the minister.
Thanks, Andrew, and thanks everybody for being here. It's an important topic, needless to say, on an important day. It's my pleasure to introduce the Honorable Minister McNaughton, Monty. He's the MPP for Lambton, Kent, Middlesex, Minister of Labor, Training, and Skills Development. I'll keep this brief. There's three things I'd like to say about the minister. First, he's a tireless advocate for the construction industry and all workers in construction. Two, he has shown tremendous health and safety leadership throughout the pandemic in order to keep workers safe and businesses open. And three, he truly understands the issues and the needs of our industry and has also brought a new focus on skilled trades and skilled trades training. So with that, I welcome the minister and I deeply appreciate him being here today. Thank you.
Okay, great. Thank you so much, Richard. It's great seeing you and seeing Andrew and so many familiar faces. Of course, I'll talk about Ron Koletsky shortly, but I see Michael Gerard and just many familiar faces. So it's great seeing everyone here today. Ron and I were on a call earlier today. So I'm seeing a lot of Ron. He and I, as I said to Ron in the beginning, he and I both have the same style of hair right now and need to go see a barber as soon as this lockdown period ends. First, I just want to say just how much I truly appreciate the partnership and support that the construction industry has shown our government, and in particular, my office throughout this pandemic. We really have worked very, very closely together. Thank you for all of your efforts to keep workers safe on job sites. I know that all of you have made numerous health and safety improvements. You continue to do that. So thank you so much. And as well, I know you're working really, really closely with Ron and the Chief Prevention Officer and his team, which is great, but in particular on the rapid testing in the construction sector. We really do need that kind of leadership and commitment to prevent illnesses on job sites. I thought I would just share an update on actions that we've taken to deal with this second wave, which as all of you know, is a very, very serious situation that we find ourselves in. On January 12th, we declared a second state of emergency since last March. Enhanced safety measures are in effect for all of the province, and we anticipate that they're going to have to stay there until at least February the 11th. Our primary and unwavering priority is the safety of workers and the public at large. Together with our health and safety partners, over 200 resources have been developed. And I'm also proud to say, and we highlighted this yesterday when we launched our farm inspection blitz, many of these are now available in multiple languages, which is great news for workers. These also guide business owners and all workers in general on staying safe in all types of workplaces, including construction job sites. For the construction sector, the guidance was updated on January 14th, and it's available at ontario.ca/COVID safety. From the start, as I said, we've really had a strong partnership, government, labor, management, and industry. And to be quite frank, that is exactly why the construction industry, for the most part, has remained open during the entire pandemic. You're building our hospitals, testing center, putting roofs over the heads of many, many families. And we just thank you for all of that. Obviously, for the very, very few actors that repeatedly break the rules, rest assured, they are going to face consequences. Over 500 inspectors are in the field every single day now. Recently, as many of you know, we hired an additional 100 new inspectors, which when they come on board will mean the most inspectorate in the province's history. These officers are ensuring that businesses are following all the rules. They're checking out that employers have appropriate safety protocols in place. They have a variety of enforcement tools now, including orders, tickets, and prosecution. So for example, just on that note, I mean, the enforcement powers that the Ministry of Labor inspectors have been given about 2 weeks ago include issuing tickets for masking. You know, we're doing a big box blitz right now. We've done about 1,000 big box stores across the province. This is just one example I can think of, but they can actually ticket customers and managers and supervisors for not following physical distancing protocols and masking protocols. So obviously the consequences and seriousness of breaking the law on health and safety, as you all know, is very serious. But when we maintain safe job sites, we know that we're protecting jobs and allowing businesses to continue operating. And I think that's the real key point here, is that it's an economic issue as well. If we keep workers safe, not only is that important for workers, but it also keeps the economy moving along and keeps your businesses open. The construction industry has been truly hard hit, but it's also just one of the most important parts of the economy. So it's important that all of you get back on your feet as quickly as possible. And the best way to do that is to keep projects safe. So I just want to say, in conclusion, keep up the great work that you're doing to protect workers. There is light ahead. We're working to roll out vaccines as quickly as possible, and obviously urging the federal government and others to get vaccines to Ontario and other provinces as quickly as possible. And as you know, my office door is always open. Waleed, my Director of Stakeholder Relations, is on the call here as well. And I know he works with many, many of you, and we're always here for you. So with that, Andrew and Richard, thanks for having me today.
Oh, that's great. And thank you for those words, and thank you for your leadership. I think part of what we've learned is we've got to get the message out. And so in order to do that, if everybody can turn on their screen, we'd like to get a screenshot, because obviously part of staying safe with COVID is promoting the message on social media and getting it out as far as we can. And you guys have done a great job with that. And thank you for your leadership, Minister. And my IT guy is going to take a photo, but I don't know exactly when. So if everyone wants to awkwardly smile for a good 10 seconds. Okay, so that's great. I guess that's not something I think we thought we'd ever do before the pandemic started, but it is what it is. Okay, so with that, thank you very much. I have the pleasure of introducing Ron now, and as we get closer to the Super Bowl, the whole idea of dynamic duos keeps popping into my head. And when you talk about, you know, Ron and Monty, I think that's exactly what we've got, and our industry has never been luckier. I don't know if it was planned this way, and you guys have certainly found your synergies together, but we're very appreciative for it. And so I think most of our members and probably everybody on the call know Ron, but I am going to give a brief introduction. He was appointed as the Chief Prevention Officer and Associate Deputy or Assistant Deputy Minister of Ministry of Labor, Training and Skills Development on March 6, 2018. I throw in that date because I think we all feel like we've known Ron for a lot longer than that going through it. And I think little did anybody know when he got appointed that he'd be perfect, because he brought his background from the Public Services Health and Safety Association. So essentially, he literally was the perfect person to be the Chief Prevention Officer for a pandemic. He's done a wonderful job, as has his team. I think we've all seen and used the hundreds of health and safety documents that's created by Ron under the leadership of Minister McNaughton. And without further ado, I will turn it over to Ron. But thank you again, everyone.
Well, thank you, Andrew. I really appreciate the introduction. And as always, Minister, it's always great to work with you and your team in trying to advance safety in construction. I just want to give a shout out to RESCON and the group for organizing this, LIUNA 183 as well, and all the other associations. I mean, this is what is needed to really promote health and safety in the province, and that is a good communication network where we have the chance to exchange ideas and you know, not reinvent the wheel, because in many cases, sharing information and good best practices is how we're going to get through this and other issues within the industry. Even though there is a crisis at hand with respect to the pandemic, we can't put aside the need for continuous safety, especially in high-risk areas like construction. I also want to acknowledge RESCON's leadership. It is Bill Let's Talk Day, and that's an important day, but what is important is that RESCON took a leadership role 2 years ago and started to recognize mental health in the workplace, especially in construction. And you know, it's that hidden challenge that we're faced with. And if we can open up and talk about it, we'll get to where we want to be a lot sooner. You know, there's been research done that 60% of workplace injuries have a mental health component. And we know that construction is a high risk, demanding, oftentimes difficult job where it puts pressure on the individual and their families. So I commend RESCON for taking that leadership role and all of the participants that have been involved. The other thing that I'd like to just acknowledge and thank both the minister and RESCON and other leaders in construction, and that is in the issue of anti-Black racism and diversity and inclusion. And Richard, your leadership in that file and in that issue has been greatly appreciated, and I think we're moving forward. And Amina is great leadership on the construction Against Racism Everywhere table that we've created. And the Prevention Council too has been involved in it. So just two things that I just wanted to acknowledge. But more importantly is where we are with COVID right now. And, you know, as the minister said, we're in the second stage of the lockdown period. The modeling had showed that we were on a trajectory that didn't have a really good outcome. So, you know, difficult choices were made to be able to restrict activity. Hopefully we're seeing some positive results that are coming out of that. But as the minister said, when this all started back in, well, actually, I don't make a habit of Googling myself, but I did look on January 29th. I did send out a note to all sort of employers saying, there's something out there. We got to start looking and being careful. So this has been with us almost a full year. But when we recall what happened when the difficult choice of the first lockdown was made, construction was restricted quite significantly, probably by 50%. But as we learned and as we went forward and we started to do a bit of sort of the numbers behind the numbers, we were able to see that the amount of effort that we put into trying to make construction more aware and safe and compliant in those early months, so March, April, and the first part of May, really demonstrated that there was a relatively low risk in opening up all of construction, which happened on May, I believe May 18th. And that carried on, and we were able to validate that through a couple of studies. The Institute of Work and Health had done a study that indicated when you take away healthcare and long-term care, that just look at general business, that only 5% of the outbreaks occurred in the workplace. That meaning that it was in the workplace where it occurred, as opposed to community spread where someone comes into the workplace and passes it on. And that was further validated in the early part of December with the WSIB's approval of COVID claims that actually took place in the workplace. And there were 11,000 approved claims, of which 90 of those claims were from construction. And in obvious cases, some of the more higher profile or sectors that you've heard in the news, clearly they had the largest. But you know, when you look at 11,000 claims and 90 come from construction, it really represents that those 90 occurrences occurred as a result of somebody coming into the workplace. And so that, as the minister had indicated, decisions were made that we could open up construction quite a bit more than we did initially in March. So those learnings were very helpful to us. A lot of what started out initially was providing the guidance notes, as the minister indicated. And I'd like to just again put a shout out to Andrew. There were three construction organizations that had approached me early on in March to say, you know, there's a lot of information out there. In fact, you know, I'd have to say the analogy is high beams in a snowstorm when it comes to COVID information. You have public health, you have Ontario Health, you have different sectors. And in some cases, navigating through that, it was difficult. So we made a decision to develop guidance notes that were in the language of the sector that we were dealing with. So people could understand, you know, some of the public health guidance translated in construction speak, if you say. And this really helped us. And from that, those guidance notes then materialized in all other sectors. And just a couple of weeks ago, we updated the construction guidance notes with all kinds of great links to resources and tools. We published a checklist that provides people with the opportunity to go through the checklist and make sure that they have everything in place. And then we went one step further, and that was to work with our inspectors to help them when they identify where there seems to be a consistent issue out there, what can we do in terms of providing guidance? So a good example was that When we go into certain places within the Greater Toronto Area, we know that there's a larger degree of diversity in business. It's one thing to have a sector plan that's well laid out in English, but if your businesses happen to talk in Cantonese or Urdu or any of those languages, we wanted to make sure that that those safety plans and information were made available to them. The other thing that we did is we identified where it appears that the transmission or vectors of transmission were occurring on business. And in particular in construction, we were able to identify some of the things. So the number one area of where the transmission was occurring was during lunch breaks, lunch periods, breaks through the day, and carpooling. And you know, people would let their guard down. They'd take their mask off to eat. They would be too close. They'd be there were just a whole number of factors. So what we did is we started to look at how do we develop materials for business to be able to inform their employees of what is happening and where it's happening. The other thing that we're starting to do now is we're starting to look at what information can employers provide to their employees that would help them during non-working hours. And that's really not traditionally what the Ministry of Labor is worried about. What you do in your own time is your own time. It's not covered in the Act. However, from a prevention point of view, helping people understand how to safely get to and from work in a pandemic, how to safely ride on transit. What do I do if my my child comes home and exhibits signs and symptoms? Just trying to outline things and make available so people from all walks of life can not only access the information, but it's written in such a way that that knowledge is readily transferred to them. So those are a couple of things that we've done. The other areas that we're finding is that some industry and construction included failing to actively screen before the worker's shift begins. Well, even though there is a low incident of transmission within the construction industry, some other studies that have been done during the rapid testing pilot project across the board in general, that people have seen about a 5% positivity rate with asymptomatic workers. So, I like to extrapolate it. It's not necessarily scientific on my part, but if generally based on a reasonable sample size, you have 5% that exhibit asymptomatic signs, but test positive for COVID. In the Greater Toronto Hamilton area, you have 7 million people. Well, 5% is about 350,000 asymptomatic people that are walking around. So it just stressed the need to ensure that you have active screening at your point of entry to the workplace, and that means asking questions, in some cases temperature checking, it just really putting the vigilance in it. And just to I use this there is a very virulent variant out there right now that the UK and other variants to the virus that exists, and that particular variant has a 10 times the transmission positivity and infection rate that the initial virus had. So we again, the importance of screening at the workplace, can't let our guard down, making sure that your safety plan is updated as your project changes. Every day is a new day in construction because every day you complete something the prior day. So always things change. So your safety plan is, really needs to be in real time. Communicating with workers, so workers are reinforced so that as someone put, you can't we can't be complacent. We can't let our guard down. We still have to clean and disinfect. We do have to recognize that, sharing of equipment and tools is part of the life, but we do need to ensure that they are disinfected and cleaned after use, and especially in areas where there's a lot of activity going on, sanitize high touch areas and deep cleaning if there has been a suspected outbreak. But more importantly, workers wearing PPE and physical distancing are really the areas of greatest concern. We haven't seen, when we look at LTI rates, some have said, gee whiz, there's a lot of distractibility out wearing a mask. If I have to wear goggles, and I've got a mask on, they fog up. We haven't necessarily seen an increase in LTIs in construction. We'll be able to confirm that very shortly. In fact, there's been a pretty steady downward trend in LTIs in construction, notwithstanding that when you have a spate of fatalities, the 6 that occurred in December, and there's been 2 yet in January in construction, people get concerned that, why is this happening? And, we are looking at root cause on those things, but we can't really make any determination that there appears to be a correlation between additional safety measures such as masking and where necessary, face covering goggles as being the cause of any additional injury. But we're not done that yet. The jury's still out. So the guidance is important, the checklists are important, the tool talks are important, reinforcement is important, and recognition that we're not out of the woods yet. Even when the vaccination occurs, what we're trying to do is we're trying to make it very clear to people that until somebody stands up and says it's over, and I went through SARS and probably many of you did as well, it was declared the outbreak was over and people then went on their way. This is a different sort of a infectious disease where we have to make sure that the bulk and the majority of the population is vaccinated, that the immunity period is recognized, but we cannot let our guard down. I would say this year, sometime at the end of this year, maybe, but as we go through the ramp up of the vaccinations, we still have to be as vigilant as we've ever been. I'll talk a bit about the rapid testing. Andrew sat in on a call yesterday. I've been working with the ministries of economic development, job creation and trade, and sorry, I'm just trying to get rid of something here. And the Ministry of OMAFRA, which is the Municipality, Rural and Agricultural Ministry. And we've been working on a rollout plan for all essential business to get rapid testing. There's not an unlimited supply at this point, but we do have quite a bit. And when I say essential industry, there's manufacturing, there's food supply, agriculture, but in addition to that, there's also the importance of high risk and vulnerable, as in healthcare, long-term care, congregate settings, and in our public safety areas where they're really truly frontline. But we have secured a number of tests for the construction industry, and we're working with the industry to be able to roll out the testing to approximately 20,000 workers. If I say 40,000 tests a week. It sounds like a lot, but it's not when we consider the size of the industry, but we're trying to figure out a way of prioritizing. Rotating, we've got to talk about logistics in terms of how you access the rapid tests, the compliance, the administration of it. We're all working on that. We've had a few pilot projects ongoing with Ellis Dawn, Local 46. We're starting one with the IBW as well. And the meeting yesterday was with sort of all the big, I would call it, Andrew, the big players of construction. We had Bird, we had PCL, we had Ellis Don, we had Menkes Daniels, RESCON, obviously, and Great Gulf. And we gave an overview of what is happening with the rapid testing. And we really need to find out who's willing to give it a try. It's not for everybody, not because they want to, because it's, but we're asking people, putting together a form that we will distribute out to the industry that will basically say, yes, I want to start, I'm ready to start, or I'm really interested in this, but I'm not really able to start for a couple of weeks or 3 weeks. So we have those 40,000 available. It'll likely be a ramp up period that those who are ready will probably start in the first week of February. And even though you might not be ready yet, as long as we're well below the 40,000, it may not take till middle of March before we get fully ramped up. But that being said, there's also the opportunity to rotate through different areas as well. Obviously, bigger sites are more susceptible. We know at the well, there was a couple of tests that have been done 2 days ago and today that were involved over 500 people. It's accessing the testing resources to get that done. We're still in discussion with the government as to whether or not this is going to be cost recovered or free. We're not there yet, but we're getting there, and hopefully we'll have everything in place, certainly by Monday, where if people choose to join in, that we have all the tools in the toolbox to be able to get them participating. So it's what we're hoping is that testing, and remember, this type of test is really just a test. It's not a diagnosis. You know, it can be subject to some false positivity, but if someone tests positive from the rapid test, they have to go get a PCR test, and that's the true diagnosis. We know that the science is changing. I mean, when this all started, you had to get your brain tickled with a pool cue. However, you know, as things go on, people are finding that just a swab of the lower pharynx or lower nasal passage and even an oral swab may in fact work. We're not there yet, but it's coming. And we also know that when this thing started, that the only people that could administer the Abbott PanBio test was a physician. That got down reduced to a regulated health professional, so it could be a nurse. And the Ministry of Health has further expanded the scope of practice to include a healthcare professional. And there is a very broad definition of that includes, you know, PSWs, trained PSWs and others, because we recognize that when you're rolling out 300,000 or so doses a week of tests a week, that, you know, you don't want to draw down on the healthcare capacity because they're busy doing other frontline work. So Andrew has part of the discussion yesterday, and we're working with the industry to send out it's just a very simple questionnaire about, are you interested and do you want to do this, or do you wait a while? Because we've really got to figure out how many are interested in this thing. So we do know that it works. There's a lot of industry that has been using it for a while as part of the test. So we're looking forward to try and get this off the ground. And, you know, it's my commitment to you that we'll do everything in our power to get the maximum number of tests available for the industry, for those who really want it and can use it. There'll be there are strict guidelines with that. Obviously, if you sign up for it, it can only be used for its intended purpose, and that is to construct a test at the workplace. Can't sell it to your brother-in-law or the guy down the street. And you have to follow the rules with respect to administration and reporting. So we've made it as less bureaucratic as we can. But we think that if we can get this done, it's going to be pretty good. So on that note, I congratulate the industry on what it's done. Just keep up the really good work. We'll keep feeding either through these mediums or through information where we can, the Infrastructure Health and Safety Association as well, and through labor associations, unions, and so on, to communicate what we can. We have some new information that we're going to be sending out on the industry. We're just validating the numbers now to take a more detailed peek at why accidents, where accidents are occurring and why. And we'll get that information out to you as quickly as we can. So on that note, thank you so much, RESCON, and thank you for everyone that's participating in this event. I think it's great. So thank you.
And thank you very much, Ron. You know, you've been working tirelessly now. I guess it's been a year. So at some point, hopefully you get a break, but we really do appreciate the efforts, and it's nice to know that we've got a champion in the Chief Prevention Office. And you know, it's not that we didn't have a partnership with Ministry of Labor and CPO before the pandemic, but we certainly do now. And yeah, your efforts are much appreciated. So we can't say thank you enough. But again, thank you. Moving on, I will introduce Mike Gerard. He is the founding partner of Gerard Coos. I went to his website, or at Gerard Coos, and I was going to pick out a couple things from his bio, but to be honest, the list is kind of so long, and everybody kind of knows him. He's an excellent lawyer. He practices, you know, in all areas of labor law, and quite frankly, outside of labor law. But his grasp of the construction industry and his expertise, you know, whether you're taking a case to the labor board or focusing on health and safety is really second to none. And so I'll turn it over to Mike at this point, and thank you very much for joining us. I should say that after Mike's presentation, we will have a pause and an opening for questions and answers. So you can either send a note to Amina Dib, and she's on the screen there, or you know, you could put it in the question and answer. So we will have time for a limited number of questions, and I'll turn it over to Mike.
Andrew, thank you very much for that introduction and the invite to join you today. My intention over the next 20 minutes is to try to give you a quick update. We say the update is on law, but as you heard the minister's comments to start us today, it really is about the partnership that we see in construction between the government, labor, management, and industry. And it's that partnership that is the context within which I want to speak today. It's that partnership that has kept you open. And so as I take you through these quick updates, keep in mind that partnership is why you were open. And I think it's also the partnership that will keep you open and potentially even open up more aspects of construction in terms of that which was slightly modified earlier this month. So I'm going to try to speak about screening, testing, and reporting, a little bit about enforcement, brief comments about liability, and then I'll introduce a topic, and literally I'm just going to introduce it and leave it. I won't say much about it, but vaccinations, because those will be on our mind, will be on everybody's mind, if not now, certainly over the course of the next 3 to 4 months as it starts to roll out with even greater frequency. So from a screening perspective, given Ron's comments as well, we're going to see many of these pilots roll out with the rapid antigen test. You want to keep in mind all of the screening protocols that many of you already have in place. And if you don't have them in place, or you're looking at trying to test that which you have in place, the Ontario government's got some great guidelines, really simple things that you're all aware of, but I'm going to touch upon them. You know, the screening of workers before they go to work or at the start of their shift. Remember, just like health and safety, it's not good enough to have done that. We must record having done that, because that materials could become important to you later on. Remember that the screening tool isn't to be used as a clinical assessment. It's all about trying to screen out people who might have disclosed symptoms of COVID and or have some criteria that suggest to us that we may want to have some testing. We really do like trying to screen workers before they get to the work site if possible. And so many companies now have set up their own apps to be able to not only have that screening done, but also to collect it from a IT perspective, as opposed to just paper copies. Consider the questions. Remember, the questions are pretty simple and pretty straightforward. We would look at all the symptoms that are listed out, and I won't take you through them. They're already on a government website, but you want to make sure that you're able to collect information that says you have checked for these symptoms. A lot of it's self-reporting, but at the same point, we're going through that. And then the easy ones. In the past 14 days, have you returned from travel outside of Canada? Do you have a confirmed case? Have you been in close contact with anybody that is probable or confirmed? Has a doctor or a healthcare official told you to isolate? And then the other one that they added recently, which makes a ton of sense for those of us who have downloaded that federal government COVID alert, have you ever received, or recently have you received an alert on that COVID app? So as I move into testing, the reason I've gone through much of what I believe you probably already know, it's none of that is replaced by the short turnaround testing, as we'll call it. That screening still needs to be in place. And as everybody knows, and I'm not intending to cover it, but all those basics, hand washing, masking, distancing, all of those things must stay in place. What we're moving into doesn't replace, it just builds on. And so let's talk just briefly about the rapid antigen test. And there are pilots out there already. And I'm going to give you 5 points to think about if you're looking to engage in the use of the rapid antigen test. The first one's relatively obvious, but as Ron has talked about, and as the minister would have mentioned as well, is your first move is to get in contact with local public health to make them aware of your intention to move into one of those pilots. That's number one. Number two, you're well served to put a policy together. So you know that the government's already put lots of sector guidance out, and one that's just been recently updated for our sector. But you do want to have a policy specific to the use of the rapid antigen screening test. Our best advice is you want to provide as much notice of your intention to move into what we'll call a pilot right now, based upon the ones that are out there rolling. And you want to share that policy both with your trade union partners and with your workers. And at the end of the day, there's a bit of a balance to be struck. But the good part is the focus of using this is another helpful way for us to contain and turn the frequency of the tests downward on that downward trend that we're all seeking. We want to continue to be the example in construction to demonstrate that we're an industry that not only is taking the normal steps, but we're going to go the extra distance to try to lead and see what other things can be done to get this pandemic under control. And so this rapid antigen test really does provide us with an opportunity to not only to see that downward turn, but actually to be leaders. And my guess, like I've seen already over the course of the last 9 to 10 months, your industry will be used as an example to model how this will be delivered in other sectors of the Ontario economy, if not other parts of our country. The balance is to be struck is that we need to be effective communicators in this area. We need to be able to answer questions and strike that balance between what the rapid antigen test will help us with, juxtaposed against individuals and workers who are going to be wondering, do I have to take this test? Why do I have to take this test? What is this all about? There's already case law out there, so I wouldn't worry too much about the legal framework. I'll give you a little bit about it, but it really is seeking to strike the balance. What are we trying to address? Obviously, the containment and ultimate elimination of the pandemic, juxtaposed against individuals' privacy. And so there is really good guidance already out there from Ontario, the Ontario government, with respect to what you want to be doing in this testing. So for example, we know that the rapid antigen test is for asymptomatic individuals. Those are the ones that they're looking to test, because the symptomatic people have already been screened out, or should have already been screened out of the workplace. We know that the asymptomatic is the issue that we're trying to deal with. And we also heard, and I think Ron commented on this, and this is really important to explain to people, is I'll call it the lesser invasive means of performing this test. And so you heard Ron talked about a combination of a swab of the larynx or the nares or the nostrils, as opposed to the deep nasal swab. And that's important to tell people. Frequency is important. There'll be some debates, but I think the guidance is showing us today that it needs to be 2 or 3 times a week in our sector. So it looks like most of the pilots are trying to work on a Monday and Wednesday testing protocol from a frequency perspective. Ron's comments also important. The people who are performing the test to you, we're just seeing that move from regulated health professionals to lesser standard, but still the one thing that's key, your workers want to understand that those who are testing them are actually required to maintain all of that information that they're gathering in a method that is compliant with relevant legislation. And there's it's called healthcare custodian, persons who are actually required to maintain the privacy of that information. And so there'll need to be some communication in a workplace as we persuade and coach and reach agreements on why we're going to do this testing. The next piece that many of you are already dealing with, but we do have some separate guidance around the province. I want to touch on reporting for a moment. I picked Durham as one example. There is different reporting protocols from public health. If you were to go to Ottawa as an example, back into Toronto, over to Durham, or out into Windsor, Essex, you want to look on the government websites because there are some subtleties with respect to reporting of a positive COVID test among your workers. And so I'll give you an example of the Durham one. Durham says, in the event of a positive, we want you, the employer, to have prepared a list of close contacts of the persons that have been in contact with that person who has been given a positive outcome on a COVID test. So when you hear that, right, a list of close persons, that means those logs that we talked about at the beginning, that pre-screening process, that log's really critical. Who was in the workplace at what time, so that you can identify where the close contacts were. Durham actually says you're going to need to provide that log to them. Can't make that up after the fact, so it's very important to be doing this proactively. The other thing we're seeing more and more, probably not if you went back 3 to 4 months, but certainly today, when you're interacting with public health, you're 9 times out of 10 going to be told to notify the Ontario Ministry of Labour, Training, Skills and Development. And most of you are already used to the kind of reporting that we have under Section 52 sub 2 of the Occupational Health and Safety Act and Section 8 of the construction regulations. Now, some people have been debating, well, wait a minute, if I have a worker who's told me that they're positive for COVID, but I don't believe it happened in the workplace, why do I still have to fill out that 52.2? Because I don't believe it's an occupationally related illness. What we've been seeing between public health and the Ministry of Labor, and I think best advice for you is still fill out the 52.2, still provide the ministry with the notice. You can make that statement in that document that you don't believe this is a workplace related illness, that you believe the workers told you. I got it from somebody I'm living with as an example, but you're still better off to file the form 52.2. The public health is also going to want from you contact details from a responsible decision maker. And so you want to think about who that's going to be in the event that you do have a positive, because that person will start to be the link between public health and your workplace, and they will engage with you. We've had a number of experiences where public health will absolutely engage. They will come to the workplace, and they're allowed to do that, obviously, and they're going to engage. And we look at it now, this isn't a confrontational litigation approach. This is public health can help us to contain the issue that we're having and or to test to see whether that issue is in fact happening in the workplace. So on the reporting side, depending upon where your workplace is, make sure you're looking at that ontario.ca information to understand whether you're falling in, for example, Durham or Peel. They're a little bit different with what triggers that obligation to talk to public health. You will likely hear from an inspector if you've made that report to public health, whether you've filed a 52.2 or not. they're going to actually ask you to file a 52.2. And we all know that we have approximately 4 days within which to file that information. I'm not going to take you through what you need to file because I think you know that, but they will ask, for example, have you notified your Joint Health and Safety Committee? What's the current status of the infected worker or workers? Do you have people that are in self-isolation? They'll want to know the dates and times, and that's why your log is so critical to you. They'll also ask you, for example, and we heard this earlier on the call today, what have you done by way of taking any extra measures now that you're aware? In other words, have you taken an extra cleansing and disinfecting approach following the case? If you did so, who did it? How did they do it? In other words, again, keeping records of this. And they're going back and forth. The ministry is going to ask you, have you informed public health? And while that may sound obvious, they are coordinating much better than we've ever seen them do so before. So let's talk now briefly about liability. And liability, it's pretty clear. The first set of tickets that we're looking at is bylaw officers being able to ticket individuals at a $750 amount and corporations at a $1,000 amount. However, be very, very aware under the Reopening Ontario Act, there is also potential liability that is much, much more significant. And I'll just read the framework. The framework says up to $100,000 for an individual, plus up to 1 year imprisonment, up to $500,000 for a director or officer, plus up to 1 year imprisonment, up to $10 million for a corporation. I'm not making those numbers up. The government's bringing the severity and seriousness of this situation to everybody's attention. I don't suggest that, let's use a quick example. A bylaw officer comes to a work site and sees somebody not wearing a mask. It's not my understanding that they will attract a $100,000 penalty in that range at all. It's my expectation and our experience thus far that we've seen them exercising discretion and staying in the first layer, the $750 or $1,000 amounts, and masking is only one example. But be very aware those are out there. Well, we won't get into it today. As you would expect, if anybody's been given a ticket or any of those other liabilities, the ticket level for sure is appealable to the provincial offenses courts. But again, not really here today to talk about how to defend one of those. I'm really here, I hope, to encourage you to participate like your industry has done so far, to find resolutions and solutions to this, as opposed to finding ways to avoid any of these increased, I'll call them increased means of safety. They really are giving us an opportunity to keep the industry open. And I really want to implore people to continue the partnerships that you're so well known for already. Last comment, vaccinations. And you'll see YouTube clips now, papers covering it all over the place about, am I forced to have a vaccination? And I think what you're going to find is extra communication about the utility of the vaccination is going to be critical. And I think it's a bit different, frankly, than the rapid antigen testing. There'll be a different test probably arise, but it's going to be the same thing. If an employer is going to try to get into the vaccination side of this and potentially provide it as a positive outcome for people, in other words, I as an employer have found a way to get these vaccinations to you. Again, same thing, policy. Get a policy out there, communicate it effectively and communicate it early. And in that policy, the framework's pretty straightforward. Is it reasonable? Right? Have you explained to people what's involved? What are the outcomes if somebody fails to get one? And so I'm not here today to suggest, that employers are going to make vaccinations mandatory. But I can tell you, if we go back to the rapid antigen testing, it hasn't so far been, and I wouldn't recommend people to think about it as if you fail to participate in this, you're going to be terminated. What we've seen in place is a much higher level of cooperation that is all around. Somebody may not be able to come to the job site, but that's much, much different than simply saying somebody's going to be terminated. And so that's a method of last resort. So again, screening, we can, maybe my last comment to wrap up, and Andrew, to make sure I leave a little bit of time for questions. My last comment is all employers and trade unions should be paying significant attention to public health because we've all experienced an evolution of their advice. And I think in fairness to public health, they continue to keep on top of the evidence that continues to grow, and we get different guidance over time. But for employers and trade unions, that guidance provides what I think of as the standard of care. And so I want to, as an employer or trade union, I want to be looking at public health as my guidance in terms of why I'm doing things and my methodology around what I'm doing. Public health is your standard of care, and I think it's a good place to look to because it does continue to evolve. So Andrew, I've tried to touch on screening, testing, and reporting, a little bit about enforcement and liability, and frankly, I just wanted to introduce vaccinations because I think it deserves a whole different discussion, frankly, at some point down the road.
Thanks, Mike. We do have a couple questions. The first one is someone emailed to me, and it was, if I get the vaccine, will I still need to wear a mask on site or in the workplace?
Thank you, Amina. That's a great question. I think right now guidance says yes. And again, I mean, the analogy to this is as we go through the rapid antigen testing pilots, and I might invite Ron to dive in there as well if he feels like it. But what we're seeing so far is even if you get that vaccine, I think you're still going to see a requirement for a mask for a fair period of time to come. And in fact, I'll double back to my last comment. I'm going to be asking public health what they think, and I'm going to be following their guidance. But Ron, jump in if you feel so like it.
Yeah, there have been incidents where people that have been vaccinated have actually contracted COVID again. So, you know, I think this is a case of just making sure it's the diligence. I mean, it's too early to be able to make determinations that, you know, a vaccine is going to put you in a bubble and you're going to be free to walk around. I would highly recommend that will not come from public health. But as this rolls out, I think you'll see more guidance coming out of the public health, the chief medical officer of health on protocols with respect to continuance of PPE.
Thanks, Ron and Mike. And there's a couple other questions. So this one is, in the case of COVID and provincial mandated shutdowns for non-essential commercial construction, it's difficult to maintain any type of construction flow. Is it possible to trigger force majeure clause for time extensions of contracts to limit liability, penalties, supply chain interruptions, etc.?
A great question, and I apologize. I'm going to duck the question, and I say it purposely because corporate commercial question, you want to go right to a commercial lawyer who's dealing with force majeure. I apologize, but it's way outside my bailiwick in terms of employment and labor law. But I'd encourage anybody that's looking at that, corporate commercial practitioners who have actually functioned in litigation around force majeure clauses.
Thanks, Mike. And then one more question. If we became aware that some of our tradespeople were working at a site where there has been an outbreak, who is responsible to get in touch with our workers if they have been in close contact with a positive case?
I tend to always look to the employer, and in that description that you just provided, if I listen correctly, it still is the employer, the subcontractor. The site owner still has obligations, obviously, but I look first to the subcontractor who, as you've just said, whose employees they are. But I still look to the owner and the operator of the site to participate. But first in time is the subcontracting employer.
Another question. How can we implement active screening at construction sites when not all workers have access to technology?
So we still see lots of construction sites still taking paper reviews. So while best practice might be before they get to site, if that can't be accomplished, there's still many employers we're aware of today who have somebody at site at gate, as an example, who are helping with paper recording of the screening. And we're still seeing people do the temperature check as well, which is a face-to-face issue in terms of when that's accomplished. But technology, if it's not there, absolutely you want a paper. And you also, to the point I tried to make earlier, you want that paper collected, recorded, and hung on to in the event that we need to do, for example, some contact tracing, where that paper record will be really critical.
And then there was one more question about some of the apps that were referenced for screening. What are the specific names of them?
Yeah, I haven't really, to be quite frank, I haven't been recommending any of the quote unquote commercial apps. I've seen lots of employers put their own app together, believe it or not. There are apps out there, but if you have any connection with an IT person, it's not that difficult to put together. Our firm, as an example, we have our own app developed by a director of IT, not significant skills to get that done. But there are, the Ontario guide is really great with the kind of questions, because you're literally just putting those questions into an app that can be self-developed. And I turn it to anybody else on the call if they want to throw an app out there. But so far, I haven't been a big fan of trying to push a commercial-based app at anybody.
Maybe that's the perfect opportunity. I think Amina's going to get a part-time job pitching the Health Canada app. So let's get the pitch, Amina.
Sure. Yeah. You kind of took the words out of my mouth, but I mean, it's an app for the workplace, but also just for everyday daily life. It's the COVID alert app that was developed with the provincial and federal government, and so I believe they've made significant upgrades so that it's now accessible for older Androids and iPhones. And all you have to do is keep your Bluetooth on. So you don't have to have your Wi-Fi on. It's just as long as you have your Bluetooth on, then it's able to kind of log with the other phones that you may come in contact with. And in order for the app to be effective, you also should be logging positive results if you unfortunately did get a positive COVID result. And then that way it just helps in the province's tracking and tracing. So make sure to download and fully utilize the app, which I will put in the chat, and we will send with the recording in a couple days.
Perfect. And even better news is it's free. So no excuse not to do it. With that, we'd like to say thank you. And we're also going to say thank you because it sounds like you're volunteering to come back in March to talk to us about vaccines. So
Anytime, Andrew. Thank you for having me.
yeah, and maybe we'll make it a true COVID event, and we'll try to do it during March break, because as we all know, travel is not recommended. And so instead of everybody going away for March break, maybe we'll do a webinar right in the middle of it, just so that everybody has something to look forward to. So, but I do want to say thank you. Your talks are great, and we appreciate that you take questions. And with that, we are going to move on to the panel. So I will introduce Peter Smith, who is the Executive Director of HCAT. With that, I've just done it, and I'm going to rearrange everybody's screen. I'm going to bring some people up and put some people down so that you have a nice visual for the panel. So I will turn it over to you, Peter. Thank you for moderating the upcoming panel.
Thank you, Andrew. I will say that you have a very low threshold of things to look forward to on March break. Could I ask the other people on our panel if you could start your video, please? Thank you. So as Andrew said, I am with the Heavy Construction Association. I'm also proud to serve as the chair of the Residential and Civil Construction Alliance of Ontario. And we have put together a cross-sector panel. I've got John Savoya from the road builders. I got Jason Audi representing labor. I've got John Kazavetsky from the High Rise Builder, and Darren Husak from Sewer and Water Main. And I'd ask each of you in turn to introduce yourself with, let us know your job title and who your employer is. So Darren, you're on top. You're muted, Darren. And can I ask all of you guys to unmute yourself? This is the classic Zoom moment, right?
Yes. Good afternoon, Darren Husak with Condrain. I'm the Environmental Health and Safety Manager.
Thank you. How about High Rise, John?
Good afternoon, everyone. Director of Health and Safety for the Daniels Corporation.
And Guardrail, John?
Good afternoon, John Savoya. I'm the Director of Health and Safety with the Powell Group of Companies.
And Jason, the best for last, right?
Jason Audi with LaUna Local 183. I'm the Director of Government Relations and Communications.
Thank you. So we have 4 themes that we want to talk about, and there will be some time for questions when that's done. So the first theme that we want to address, and that goes to John Savoya at Powell, are how are we going to adapt to these new rules? Do we want to talk about the lockdowns and the new measures that are announced? How do you stay up to date with those? Are there any toolbox talks or site education that you want to talk about? And do you have coordination between the offices? And do you have any suggestions on best practices? So John, over to you.
Thanks, Peter. Well, so first of all of the measures that are announced by the provincial government that directly affect the workplaces, they have codified legislation behind them. So in the same manner that the Occupational Health and Safety Act and regulations are the minimum requirements that workplace parties must adhere to, the regulations made under the Reopening Ontario Act work the same. So regulations such as OREG 8220, which applies province-wide during the lockdown period, they provide clear instruction as to how businesses who are permitted to continue operating, such as construction, are required to protect their workers. So it's important for employers in the industry to keep up to date on this legislation to ensure compliance. It's harder to base your policies on a press conference than it is on actual legislation. So like the Occupational Health and Safety Act and the regulations for health and safety, an employer can go above and beyond the minimum requirements outlined by the legislation, but can't be non-compliant with the legislation. So for example, the law requires fall protection, where a worker is exposed to a fall hazard of more than 3 meters or 2.4 meters respectively under section 26.1. But some employers have site-specific policies, such as a 6-foot tie-off policy, for example, so they've gone above and beyond the minimum requirements outlined by the legislation. So the same works for the COVID-19 related legislation that applies to your workplace. Excuse me. So at the moment, OREG 8220 is the law of the land considering the provincial lockdown. As reopening occurs in stages, other legislation will come to the forefront, such as OREG 36420. So compliance is achieved if you meet the minimum requirements as defined in the legislation, but nothing stops you from going above and beyond. In regards to educating your workers, you can build the most comprehensive policy on the planet, but it means nothing if you don't communicate it to those who need to read and understand it the most, which is the workers. Don't forget that the Act, the Occupational Health and Safety Act, requires employers under Section 25(2)(a) to provide information, instruction, and training to workers to protect their health and safety. So writing a policy and a COVID-19 safety plan is the first step, but you got to ensure that workers understand that plan. Excuse me, and they know the contents of your plan and your policy. That's really what's important. So communicating these policies and procedures to workers, it can be done in a variety of ways. Safety talks geared around the policy are a great way of communicating not only the expectations of the employer, but also what tools are available for workers in preventing workplace spread. And enforcement plays a big role here as well. As with all health and safety matters, even outside of COVID-19, the employer has the primary role of ensuring compliance within their own ranks and on their own sites. But enforcement should start with education. Communicate the expectations and the measures you've taken to prevent workplace spread, ensure that workers understand that information and enforce non-compliance accordingly. COVID-19 measures in the workplace, in my opinion, should be treated in the same manner that you would enforce fall hazards, right, with zero tolerance, because it's a killer contravention. Signage, in my opinion, also plays a big role on job sites. So I myself am a former Ministry of Labor inspector in the construction program. I was out of the Toronto West office. And when I was an inspector, every time I would enter onto a job site, I would deliberately look to see if the employer, the constructor, had signs, clearly visible that, indicated the presence of a hazard or communicated a safety message. Visual reinforcement of the employer's expectations concerning COVID-19 and any other hazard for that matter keeps it fresh and visible and hard to miss. And if you have a variety of different trades on your site that speak a variety of different languages, it's important to post that information in a language that the workers can understand. In terms of best practices, I feel that with the constantly evolving requirements concerning COVID-19, it can be difficult to stay on top of the requirements. I know health and safety departments across the province have probably written more policies and made more revisions to existing policies this past year than they've done in their whole career. So again, when you're communicating these changes, it's important that workers understand the message. Any updates or changes you make, they should be explained to workers who might not see the, minute differences in the changes that you've made from the previous version. Take the time to communicate to your workers and supervisors to ensure that material is understood realistically. And that's what I would say is probably best practice in that. This changes so often and so frequently that constant communication is probably your best vehicle to ensure compliance, but you also have to step up enforcement, right? So.
Thank you, John. So any other members on the panel, do you have any comments other than the IHSA website? Is there a place we can go for up-to-date information? I was pleased to hear from the minister that some of this is now available in other languages. And is that also posted on the IHSA website? Do we know that?
If I may, there's some on IHSA, but the Ontario government COVID-19 website has it categorized by sector, I believe, so you can access that information through there. But IHSA does have additional information as well.
Any other comments from our panel? Okay, so if we move on now, moving from building on that, I'm going to ask Jason Audie, who's with LiUNA. Did I actually get you to introduce yourself? Maybe you should, Jason.
No, you did already, Peter.
Okay. How can labor and management work together? How can we maximize the value of the Joint Health and Safety Committee? COVID-19, our response has been based totally on teamwork. Do you have any thoughts about that? And certainly the numbers are going up. It's pretty scary out there. What can we do as both management and labor to solve this problem?
Yeah, thanks, Peter. I think one of the things I'll say about construction is that it is literally a fishbowl. The members of the public can see what our employees, our workers, our members are doing at all times. And so everybody's watching. And unfortunately, there's some envy because we are essential and we are working. And so that causes the public to raise alarm bells quite quickly when they see non-compliance. So from our standpoint, from a teamwork standpoint, we really need to reinforce the messaging of compliance with all of the public health guidance, the best practice that's been produced by IHSA. One, to keep our members safe and employees safe, but also because we're signaling a message to the public, right? The public is watching. And unfortunately, a lot of people in the public don't want us to succeed. They want us to fail. And they are the first to call a counselor or their MPP to report this job site has non-compliance and these workers are not following the rules, and why do they get to work and I can't? So, the one thing that we're reinforcing to all our reps, to reinforce to the members and our shop stewards, is really to John's point about, listen, these are the rules. These are the rules in the place to keep you safe. Follow them at all times. It's imperative. The other thing I'd like to add is I think we have to always remind our community that this is a shared recognition on what we're working on is trying to keep the job site safe and you as employees safe. So following the guidance is imperative to that. How we approach employees, I think, goes a long way as we're trying to figure out new grounds on rapid testing and sort of the legal obligations and compliance about that. So approach is important. that we're doing these things to keep the job site safe, to control any potential outbreaks, and so we have the most amount of knowledge to contract trace if there are positive cases. So cooperation is critical, and it has been, I think, as the minister said, it has been the reason why we've been able to stay open. That cooperation between labor and management and government to drop some of the sort of, our typical acrimonious relationships and work collaboratively together to try and keep job sites safe. And another point that John raised that I think is really helpful is this idea of signage everywhere, reminding workers the importance of wearing their mask, maintaining the social distance, just a constant reminder, as well as reminding folks that this doesn't stop at the job site. It also is something, unfortunately, that is at your home, on your way to work, on your way to the grocery store. So the same level of diligence that is required on the job site has to be taken when you leave the job site. And that's something new, because oftentimes, when the tools are away for the day, sometimes it's easy to say, okay, well, that's enough on the health and safety side for the day. I'm coming home safe. But in this case, you really need to bring it home with you, that same diligence. So I guess that's what I'd have to add. I'd look forward to hearing from the panelists if they have anything else they'd like to speak to.
Gentlemen, any suggestions from the management side on that front? I think there is no other thing than we are more in this together than health and safety. And certainly COVID brings that to the forefront. Ron, are you?
Yeah, just, that was great, Jason. The other thing that I would say is stay informed. I mean, that there's so much happening out there with the evolution of products, approvals by Health Canada. Yes, we have the Abbott rapid test, but no doubt that over the next couple of months, there's going to be other tests that come out that are evolving and less invasive and equally accurate. And, I think it's important for leaders, whether it be labor or management leaders, to constantly stay informed. Ask questions if you don't know. Don't surmise, because I think we are living in an era of one great big petri dish that people will be analyzing for the next decade. And those who have done well will stand out, and we will learn from this about valuable lessons for health and safety in the future. So just stay informed.
Yeah, I just thought of another point as Ron was speaking. I think this conversation is going to be really important as vaccines start to roll out and COVID fatigue really is rampant, and people feel, I don't have to wear these masks, I don't have to follow these rules. And so this conversation is important now, but 3-4 months from now, it's going to be really critical. We should probably start preparing our folks for that.
I think you're absolutely right, Jason. Absolutely right. I'm concerned about a third wave when people that have had their vaccine let their guard down and start saying, well, I don't need to wear a mask. And, they can be super spreaders after the fact. So moving from there, and we're talking, this is a great segue. How do we fight complacency and promote this ongoing culture of COVID safety? This new variant is a pretty scary, it's much more communicable. And what's disconcerting, there's over 400,000 unionized construction workers in the province. If we have 99% compliance with masking and social distancing, that 1% still means that there's over 4,000 people out there that are non-compliant. How do we address making sure it's 100%? and how is the best practice that we have out there to fight that complacency. So I'm going to turn over to John the Builder to talk about that.
Thank you, Peter. I will drill into what John Savoy said a little bit earlier about stepping up enforcement. But before I get into that, I do want to thank the panel and everyone on the call today for helping us really raise the awareness and drive our collective COVID risk. Say that as a sector. The way I look at this is we've been on this boat since March of last year. I believe most of us are trying to row in the same direction. It's important to remain vigilant, of course, for the protection of the workers, as Ron and Monty have outlined earlier. And I would go as far as to say as protecting the integrity of our construction. The news tends to highlight negativity. I think it falls short on highlighting the excellent efforts that people do at the workplace and specifically in the construction sector. So again, I thank everybody on this call for those efforts. I'll echo a little bit more that everyone is collaborating. That was a key word I heard earlier. That's important not only in the current state, but to get us through to the end of this pandemic. So I thank all of our partners for being able to do that. What I'd like to really focus on is nothing new. It's really the quality management system process, and that's the Plan, Do, Check, Act. What I'm really going to focus on in this presentation is talk specifically about the checking and the acting. So that's focusing on that. So a couple things that we're doing is ensuring that site superintendents are enforcing the rules on a daily basis, going out and actually walking the job site to make sure people are following the rules. And we've also gone a step further beyond the typical weekly inspections that we have our health and safety consultant do, and quarterly as well. We're also stepping up those observations sometime twice a week. And the more frequency you can do that and identify where those gaps exist, I think the better off we are. But the key in that quality management process is to check. That's part of the inspection process. But what I would say is the ultimate important point out of that quality management process is acting on what you're finding. And so what I'm going to talk about specifically in our plan is the mask use. And what we've done is sent a letter to all Daniel staff and trades, specifically, requiring masks to be worn 100% of the time. And we're no longer splitting hairs with regards to you can wear it indoor, you need to wear it indoors, you don't need to wear it outdoors. We're no longer splitting hairs like that. The rule is you wear it all the time. And considering the new variant that we're hearing about, I think that applies even more so. So back to the acting portion of the quality management process is the accountability. And so through that letters, I should say, what we have done is highlighted the expectation, but then the repercussions in not following the expectation. And that starts with a written warning, a suspension, and then a termination. And we are strict with regards to that disciplinary path for the protection, again, of all the workers and their families, because the reality is you can bring this home. So it's not just a hazard that stays at the workplace. It's something that can be brought home, the same as asbestos or other hazards as such. So it's important that we put action behind the words. And what I would say is they're empty words. And I'll give a shout out to Jeanette Patika, one of my colleagues, who said that to me in some of our other discussions. I really could show you the best policies, procedures, tools, equipment, training out there. But if you don't hold people accountable, they really are just empty words. And so it's important that you crank up accountability and sustain that culture of safety. And we've gotten actually collaboration through unions, through various stakeholders, wherever the information comes from, whether it's a consultant, the ministry, the union, or even a homeowner, where we start to have these closings happen. We actually take it seriously and hold people accountable. So, and that kind of feeds into the second question you asked about fighting complacency, Peter. It really comes down to accountability. There's nothing more I'm going to say to that. You really do need to hold people accountable. But when it comes to, now I'm going to shift gears, just talk a little bit about some extra challenges with winter and other kind of best practices we've looked at. And that includes separating offices so people aren't congregating all in one office. From the physical distancing side of things, we are promoting not just a 6-foot distancing. We're actually going to the extent of saying 8 to 10 feet. Again, trying to exceed requirements and listening to the science, listening to public health, really like Mike said earlier, right? That's the standard of care. So we really need to listen to what the specialists are telling us and where we can exceed what they're telling us. Again, back to the new variant and what we're hearing about it. Extremely important that we keep people away, and where that can't happen, away from each other, sorry, we then enforce and make sure people are wearing the masks. But just some other quick little best practices, turning on parking level exhaust fans, setting up open commercial spaces, leaving windows and doors open, of course, so fresh air can move in there and dilute the particulate and whatever else is in that space. Again, limiting how many people can go in there, rotating scheduling staff and limiting any overlap, implementing a ban on in-person meetings where they don't need to occur. We're also now saying, if you don't need to meet in person, pick up the phone or do a virtual meeting. With today's technology, there really isn't any excuse, as long as you've got the signal and whatnot. It is possible to mitigate that risk. But I do want to highlight a little bit more on what Ron spoke to about, the physical distancing when it comes to lunch areas and the carpooling and cigarette breaks. Again, back to accountability. We need to call people out on this behavior. If we're seeing it, we need to ensure we're having conversations, yes, with the workers, but with the managers as well, the management team, to make sure they're enforcing those rules right out of the gates when they leave their yard or facility and come to the constructor's site. So again, very key that we're calling that stuff out, cranking up accountability, sustaining that safety culture that every worker expects when they walk on a job site. Cleaning, of course, we've talked about that to encourage that wherever we can. It really is another layer of protection. So again, I don't think it's one thing that's going to beat this thing. It's going to be all of these things. And what I will say is we all have accomplished a lot over the last year and are going to need to continue to do that going forward. And that comes through collaboration with the various stakeholders that we've already partnered with and continue to adopt best practices through that. I think we all see the light at the end of the tunnel. The island is there. We're all trying to row in the same direction. There are a few people who may not be rowing in that direction, and don't be afraid to call that out. And in the midst of this, I will echo the mental health element of this. It's important. Today is Bell Mental Health Day. Thank you, Andrew, for bringing or shining light on that for us today. If you need help, reach out. It is a very difficult time, and really the only way to get the junk out of your head, if you can say that, is to talk about it. And so I encourage you to do that. But I'll close it with saying, if you see somebody not really following the rules, please say something. You don't have to do it to them if you're not comfortable. Say it to their supervisor, say it to the manager or whoever it is to raise that awareness and drive the risk down. But thank you, Peter and Andrew, for the opportunity.
Thanks so much, John. So speaking of light at the end of the tunnel, I'm going to turn this last segment over to Darren Husak, who's the lightest and brightest of all of us here today.
I'll certainly agree with that one.
So some of the questions that are areas I'd like you to think about are, how are we going to be able to promote the vaccine to all workers? When will the COVID-19 protocols change the mask use? When I get my first jab, can I stop wearing the mask? Are there concerns still about running out of PPE? And are there any other issues that you think we should bring up, Darren?
Oh, okay. In terms of promoting the vaccine, I don't think there's going to be much of an issue with getting our guys to go. I think across the board, workers will be lining up to get their vaccinations as soon as possible. The government has done a great job in getting information out about what the vaccine is and any of the side effects that potentially, who should be getting it, and all that kind of side to it. We do know that obviously there will be some people opposed to getting it. There'll be some anti-vaxxers. I know we have some guys that still don't believe COVID is an actual thing. But I think besides those people, you're never going to convince them anyway. When we get the majority out there going, I think that our workers, just like everybody else, are going to be trying to be that first in line to get in there and get it done. But going back to the whole question of is the light at the end of the tunnel with the vaccinations, yeah, I think that's how we actually do get out of COVID, is once we get to that full size of vaccinations that are going to happen, and we get to that magical herd immunity that everyone keeps talking about. But before that, and I know you mentioned it, and there's a few other people that have said a couple comments about it. I'm quite concerned that we do end up with what you termed as, and I'll term it the same thing, as a third wave coming forward. As we do get closer and closer to people getting vaccinated, we did see with the second wave came through, it started to get worse and worse. And then, COVID fatigue is definitely a big part of that. It doesn't seem to matter regardless of what laws and regulations are in there. For example, leading into Christmas, we all heard it everywhere across the news: stay home, no family gatherings, nobody from outside your household. Yet when polls were taken after that, roughly 50% of the population ignored it and still had get-togethers with family and friends. So when we get to that period of where we start getting more and more people getting vaccinated, presuming they start mid to late April across the masses, that's another 3 months away. What's COVID fatigue going to be like by then? And then what will happen when you get 15% vaccinated, 25% vaccinated, 40, 50, 60? How many people will let their guard down? And the current levels of COVID fatigue at that point, we could end up with a huge spike. And that's where I would say that we might be into a third wave, which will only be resolved once we get to that point of herd immunity. But hopefully at that point, the vaccinations are, at this point, they're already getting into all the most, like the aged and the infirm and all the long-term care homes, and they're getting into the frontline workers. Hopefully we'll be able to get through that without too bad, even though the numbers might be huge. Going further, you asked me about when can we expect the end of masks. Honestly, I don't see it until we get to that tipping point of the herd immunity starting to come in place. And I can't see it until, as Ron said, we finally get somebody to stand up and say, okay, the pandemic is over. I know that seems like a long, long time. I would think it's, mid to late fall or beyond, presuming we can maintain the vaccine lines of coming into us.
That was not exactly the bright light at the end of the tunnel we were hoping for, Darren, but it is very realistic. Yeah.
Yeah.
One thing I think we should always be aware of: winter is an extra challenge. You've heard before that many of the times that people are contracting it on site is during lunch hour or the break. And in the summer, they mitigate that. They sit outside at different spots. They spread out. They might eat their lunch in their truck. That's not possible in the Canadian winter. And there's studies showing that cool, humid air that we get in the winter is the droplets from COVID stay in the air longer. We have to be really careful. So, do you think we're going to run out of PPE, Darren? Is that a concern?
So from talking with different suppliers, I don't think we'll run out of the supplies that we need. I did hear of another 1 or 2 places starting to make N95s here in Canada. So I think we will get back to the point where, control of the situation will happen and we will get back to the surplus. It's just learning to utilize that PPE a lot better, I think is the main part of that. And don't get me wrong, I'm not all doom and gloom about this. I think we're doing an excellent job at controlling it. As Ron has talked about earlier with the WSIB numbers, and that our numbers within construction itself are not bad. They're very encouraging in terms of how well we've done at managing COVID within our workplaces. And I hope that we can continue on that. And I think utilizing what the other 3 panelists have talked about in different ways, we'll be able to keep it at bay as best we can.
Thank you. So we want to kind of wrap up, gentlemen, but I'm going to ask you one last question. Try to keep your comments brief. If there was one idea that you want to leave with the participants, and I'm going to ask Ron to think about that question too. So, John from the Road Builders, you're first. Any last thoughts?
Yeah. So what I would say is COVID-19 is a workplace hazard, right? We can't lose sight of this. As health and safety professionals, this is what we deal with. We deal with hazard mitigation and prevention. You need to apply the same principles you would use when you're discussing a fall hazard or trench wall stability. Apply them to COVID-19, right? Solutions may be different, but the fundamental idea is the same. Keep workers safe. And remember 25-2H.
Okay. Jason, you're up.
It's always a tough one, but I guess my big takeaway would be, keeping you safe at work helps to keep those that you love safe as well. And so together we've done tremendous things, and moving forward, that level of cooperation and collaboration will be beneficial to the industry and keep us working right through this thing.
I really like that one. That hits home. John the Builder.
Thank you, Peter. I really just want to build on what Jason just said, in keeping in mind that people's actions each day can affect others, and not just the individual, but their families. You don't know what the circumstance is to the person that you're standing beside when they go home, whether they've got a loved one that they're caring for that may have an immune compromised system, or I could go on with different disabilities that may be out there. So it really is important that we call out that selfishness when somebody is being selfish, and make a point of it, because if we don't, it just starts to spread and that behavior becomes the norm. So I just say, if you see something, say something. It's for the greater good of everybody in doing that. And that's what I'd like to leave last.
Good, thank you. Darren, any thoughts?
I'm gonna take this in a slightly different direction, and it's gonna echo straight after what John just said. If you see something, say something. Well, today is Bell Let's Talk Day. And I think there's the huge mental side to this that doesn't get the attention it really does. And today is one of those days that we really should be putting a little bit more to it. Well, we're all individuals and no one else can feel the emotions that we as individuals are going through. Remember that no one is going through COVID alone. if you've contracted the virus, obviously it's you in general that's dealing with it, but you still have your family and everybody else around you that is affected as well. In the broader sense, we're all in this together and must rely on every one of us to get through this. We all find it tough to be isolated. I don't think there's anybody out there, even introverts, that are enjoying going through COVID right now, the whole side of it. Remember, we're lucky that we're in the construction industry. We've been lucky enough to be considered essential throughout all of this, other than a very short period. Be proud of that. Remember the buildings that we're building things, but that's not all that we do. We build relationships, and part of that is caring for those around you. Just make sure you can have that chance to reach out to other people and make sure to open up those lines of communications so that those people that might need it are empowered to reach out to somebody that they can.
Thank you, Darren. And Ron, do you have any last thoughts?
Yeah, I think it's all been said that we are in this together. This virus affects labor, it affects management, it affects everyone. So, you know, 3 C's, collaborate, communicate, and cooperate. And I think we'll get through that.
Thank you. I think if there's any subset of the construction industry that's probably affected the most, it's all those health and safety professionals that are out there. And I'm sure that there's days when you thought you were completely burned out and the next day was even more challenging. So I would suggest that you reach out to your other health and safety professionals. A lot of local associations have safety forums. I know ours does. Talk to other people, get innovative ideas from them. Have them talk you down from the ledge if you're having a particular bad day. It is a challenge. Anyway, without any further ado, I will pass this back to Andrew Pariser. And thanks so much, panel, for participating. We appreciate that.
Thank you.
Thank you.
Yeah.
And thank you to the panelists. What we do is, instead of really giving anything to our speakers, we pick a charity whenever we do a webinar and we make a donation. Because it's Bell Let's Talk and the focus is on mental health, that charity is fairly well known. And so what we're going to do is we're going to focus on Threads of Life. Threads of Life is probably a lesser known charity, and I think they probably do some of the most important and best work, and they certainly deal with mental health issues, because this charity essentially provides supports to families when a worker dies at work. And so it's peer-to-peer support. They provide mental health support, but they essentially, when the worst thing happens, they're there for that family that are going through it. And so we're going to make a donation to them, and we encourage everyone to look at it. Just as a final thought on the panel, it was phenomenal. Thank you guys. Darren, I actually think you were being positive. One of my best or favorite quotes is, we have to hope for the best and prepare for the worst. And then we're never caught off guard. And thank you again to Jason and our management partners for being on here. Teamwork is it. And it is really impressive what we can do when labor and management comes together. And the more of that we can do, and hopefully we can take that message coming out of the pandemic and not forget it. And again, Ron, you can stay on all day, every day, because your comments are always welcomed. But I am going to turn it over to Nadia right now, who is the executive director with the RCCAO, and she is going to give us our closing remarks.
Great. Thank you so much, Andrew. Good afternoon, everyone. As Andrew mentioned, my name is Nadia Todorova, and I'm the Interim Executive Director at the Residential and Civil Construction Alliance of Ontario, RCCAO. We have been one of the partners of today's very valuable webinar. I want to start off by saying a huge thank you to Minister McNaughton and Ron Kolusky. The government's support and leadership during this pandemic have really been vital to our industry and to all Ontarians. The decisive and methodical approach taken by government, along with the enhanced health and safety guidelines that the ministry developed, really ensured that construction could continue safely. Thank you to all of the industry experts who took time from their busy schedules to participate today and offer their valuable expertise. And finally, thank you to each and every one of you who joined the call today. It's really through these collective engagements and vigilance from everyone in construction that we will emerge victorious against COVID-19. There were so many valuable discussions that took place here today and many helpful tips and resources on what industry is doing and can do to remain safe during the pandemic. I think the fundamentals are very simple, but very, very important. Stay vigilant in the workplace and at home. Do not give in to complacency. And if you have not done so already, please download the COVID Alert app and use it to its full potential. I believe Amina already shared the link. Do not be afraid to have conversations with your fellow workers and supervisors on health and safety issues. Be collaborative and always remember that everyone has the same end goal, staying safe and healthy. Again, thank you to everyone for being here today and for all the people that were involved in putting together this webinar on such a short notice, including and especially Amina Dib and Andrew Pariser. Again, stay safe, everyone, and enjoy the rest of your afternoon.
Thank you.
Thank you, everyone. I think there's a couple more questions that I'll answer in the chat and then we'll shut it down. But yeah, thank you to everyone for coming. A video recording will be made available as soon as possible, but certainly by early next week. And yeah, just one final thank you to the panels and to Ron for your leadership. You know, we really, really appreciate it. Thank you.